Good afternoon. Hello, everyone. Happy Friday. Welcome to today's panel, Vaccinations, Vaccine Trials in You. This is the third of three lesbian, gay, bisexual, transgender, queer, and two-spirit panels. This panel is designed to provide information for Black, Indigenous, and other people of color, and is especially relevant now in light of the additional burden facing BIPOC communities across the nation. This panel will be recorded and will be available post-discussion. Before we begin today's program, I would like to ask everyone to join me in our land acknowledgement, courtesy of the DuwamishTribe.org. We acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present, and honor those with gratitude, the land itself and the Duwamish tribe, and that we are on the unceded ancestral lands of the Duwamish people who are still here, continuing to honor and to bring to light their ancient heritage. Thank you. Be sure to check Age Friendly Seattle's website for today's recording of the panel and for the two prior LGBTQ plus two-spirit panel discussions, Thriving or Just Surviving during the COVID-19 pandemic, which was featured in July, and what we learned from HIV/AIDS with COVID-19 in June. We would also like to acknowledge some of the amazing partners in the Human Services Department, including Lenny Orlov, Michael Taylor Judd, Justin England, and Andrew Millspots for their technical support. Closed captioning for today's broadcast is available in 7 languages, including Arabic, Spanish, Chinese, Korean, Russian, Vietnamese, and of course, American English. Before I start, I also would like to invite you to join us for the second annual Generations Celebration, a free virtual gathering on November 18th, 2020 from 4 to 5 p.m. Pacific Standard Time. This year's Generation Celebration and Conference will be held to solidify our common ground in the context of a global pandemic, celebrate advances in health and longevity, honor those we have lost, and illuminate the steadfast work needed to advance racial equity and intersectional justice. Generation Celebration emphasizes the need to combat social isolation of LGBTQ elders by building community, and we're inviting LGBTQ plus two-spirit people of all ages and allies to tune in for an hour of amazing entertainment and engaging and timely presentations. For more information, call 206-543-2449 or go to https://genevents.org/2020-conference-gala/. Again, if you're just tuning in now, hello and welcome. My name is Brent Butler, and I am the Age Friendly Program Manager. I use the pronouns he, him, and his, and I will be your moderator for the day. LGBT plus two-spirit and BIPOC, vaccines, vaccinations, and you is the title of our presentation panel. Age-Friendly Seattle implements events, programs, and activities to promote health and well-being through 29 initiatives that stem from the community. A focus of our work is to create environments that make communities, neighborhoods, and places in Seattle great to grow up and grow old. We are honored to be joined by our amazing group of experts. Today's panelists are Russell Campbell, Deputy Director of the Office of HIV/AIDS Network Coordination. Russell Campbell serves as the primary point of contact for the HIV/AIDS Network Coordination for activities in his role as the Community Partners Coordinator. Russell helps manage community partner document development and implementation, including work plans, operating procedures, communication plans, training manuals, and best practice guidelines. As Community Partners Manager, Russell's administrative and project management support for community partners and related working group brings us actually here today. Our next panelist is Esther Lucero Dine, Chief Executive Officer of the Seattle Indian Health Board. Esther Lucero is Dine and Latina and a third-generation urban Indian from Colorado Springs, Colorado. Esther became CEO of the Seattle Indian Health Board in 2015 and established a leadership team that is leading the change toward an informed system of care that is grounded in Indigenous knowledge. Esther's various positions with the Native American AIDS Project and the Native American Health Center before joining the California Consortium for Urban Indian Health, where she oversaw 10 health programs throughout California, along with her passion and advocacy for Native health and transformative approaches to Indigenous research and evaluation, general Indian law and policy, reproductive justice for Indigenous women, and LGBTQ two-spirit health has made her a leader in Seattle and nationally. Our next panelist, Peter Mann-King, who uses the pronouns he, him, his, is co-chair of the board of directors for Gay City, and many of us may have used those services, Seattle's LGBTQ Center and Program Manager, and serves as the Swedish Health Services LGBTQI+ initiative. Peter Mann-King studied Latin American Studies and Spanish at University of Washington and earned his master's in healthcare policy and management from the Carnegie Mellon Heinz School of Public Policy. His areas of interest are quality improvement, population health, and health equity focused on elderly, Latinx, and LGBTQI+ communities. When not on a Zoom call, Peter is playing volleyball or running. Our next panelist is Karina Walters, Professor, Catherine Hall Chambers Scholar, co-director of the Indigenous Wellness Research Institute. Professor Walters is an enrolled member of the Choctaw Nation of Oklahoma, is the director and principal investigator of the Indigenous Wellness Research Institute at the University of Washington. Dr. Walters has more than 25 years of experience in social epidemiological research on the historical, social, and cultural determinants of health among American Indians and Alaska Native populations, as well as chronic disease prevention research. Much of this social epidemiological work has targeted urban American Indian and African Native and LGBT+2 spirit, Asian, Alaskan Native populations across the United States. We are excited to have Professor Karina join us today on this panel. For our dear viewers and listeners, if time allows, we would like you to answer some of your questions and also provide some feedback. Please enter them into the Q&A chat box. We'll also attempt to get callers on the line as time permits. Now, I'm going to move forward to our questions. Our panel is on the PowerPoint presentation, and our first panelist was Russell Campbell, Esther Lucero, Karina Walters, Peter Mann-King, and now it's time for us to start asking our panelists some of these very important questions that come from a deliberative discussion among our panelists. Give us some historical context around vaccines. And our first panelist to answer this question will be Dr. Karina Walters.
Good afternoon, everybody. Well, first I'd like to set the context, at least from an American Indian, Alaska Native perspective, and I know other communities of color are dealing with this as well, but the context of settler colonialism has to be identified. Settler colonialism is a system that was designed and continues and is designed to basically erase indigenous people from the land. And we can see this with the eradication of Two-Spirit people from the start when Columbus arrived, immediately wanting to kill us. So that's a real historically traumatic event going way back at the very beginning of contact with Europeans. But at the same time, they brought diseases with them, the colonists did. And exposure to these diseases also led to the death of tens of thousands of our communities. And part of these diseases were used in weaponized ways. Smallpox is a great example. Colonel Bouquet actually introduced smallpox blankets as a strategy to eradicate some of our communities. By 1832, there was a passage of the Indian Vaccination Act by the United States government. Now, it was not for our welfare. It was actually designed to try to promote Indian removal. Congress had passed through Andrew Jackson and others. They passed the Indian Removal Act, which is known as the Trail of Tears to more commonly. And they needed to remove people, and they wanted to ensure that the settlers that they'd be encountering would not get the diseases that Native people were being disproportionately exposed to. Smallpox is one of them. So they gave us a lot of people the smallpox vaccine, but they did not give it to the plains communities. For example, the Mandan and Hidatsa during that period lost 90% of some of their villages. So it was devastating. So again, it wasn't with the intention of helping us. It was really about protecting the settler population. 1920s, there was a lot of experimentation and with medicines and surgeries. Trachoma eye surgeries, for example, removing eyelids of Southwestern relatives, leaving thousands blind. It was experimental. So we were experimented on. That includes all the way from the 1950s with iodine experiments, with radiation introduced to our Alaska relatives up there. And of course, that also raised the issue of proper informed consent. The community did not have proper informed consent under those conditions. Breastfeeding moms, for example, were exposed to radiation. And then looking to our LGBT community in the 1950s and 70s, a lot of our folks were placed into state mental hospitals just for being gay, and they were experimented on. Camarillo State Hospital is a good example, where they performed medical castration and lobotomies on our communities as LGBT populations. So it's understandable and justifiable why our communities question the veracity and the safety of vaccines when they're introduced, because there's a long history and there continues to be a system that's in place that does not consider the welfare and benefit of our communities. So it's healthy. It's a good, justifiable, healthful response for our communities to ask the hard questions and say, really, is this a benefit to us, or what is this really about? I do want to acknowledge, though, that we did participate in the 1950s in a TB vaccine study, that it turned out that it actually worked. And the vaccine efficacy for TB persisted for at least 50 to 60 years. So, and there have been some successes. So just to recap, the genocidal policies, medical abuses, vaccine and medical experimentation was not ever intended to benefit the community historically. Plus, you combine that with other kinds of historically traumatic events that our communities endured, poor access to quality medical care, and when we do raise concerns, they tend to be dismissed. So these all lead to higher levels of mistrust. And then one thing that I want us to walk away with, though, from this is to think about, now we do have better sovereign protections in place. Our tribal sovereignty is more activated now. Our communities are better informed and taking advantage of the opportunities around science that really ask these kinds of questions. So I think the way to think about this is the issue isn't so much bad science, because vaccines have actually been helpful for our communities, which we can talk about later, but rather bad scientists within a bad system that was rooted in settler colonialism. So it's important to separate those things out, because if we understand that the science could be potentially beneficial and we get the proper information so we can make informed, healthful, collective, and individual decisions, then we are truly enacting our tribal sovereignty and our individual sovereignty. So that's what I have to share on that. Thank you.
To Esther Lucero on this really important context around vaccines. Esther, what would you share with the community about vaccines?
Good afternoon, everybody. Well, have to tell you, Dr. Walters said quite a bit, and there's a reason I consider her one of my teachers, continue to learn from her and to grow. But I will add a couple of things. I think that what she painted a picture of are the ways that our communities have actually experienced just the healthcare delivery system, vaccination processes, research processes that have impacted our people negatively. And the way that's playing out today is that when we are being offered access to testing the vaccinations within our tribal communities, we have a really significant split. Those who are still kind of feeling the historical trauma of past abuses, with those who recognize that we also want to make sure that these things will work within our own specific communities. Historically, when vaccinations have come out or treatments have come out, they haven't always been tested within our populations. And so largely they've been tested within white male populations. And so they haven't always been as effective for us. And so there's real, conflict there, and reasonable conflict. It makes me think about, in my tribe, Navajo Nation, they had tested HIV meds within our tribe. And when they found out that, in fact, there was actually some success in that treatment model, the treatment was no longer affordable. And so we didn't have access. And so that's another issue that comes up, right, is even if the federal government uses the Indian Health Service system, as they often do, as a ready-made lab, and they test these things within our communities, when they're found to be viable, then somehow equity is no longer relevant and we don't have access. And so I would say that that's one of the reasons we're actually putting out some recommendations specifically dedicated to our tribal communities and our urban Indian populations. And the first one is something that Karina highlighted, which is, we really have to respect and honor tribal sovereignty. Sovereign nations means that we have nation-to-nation agreements, and that means that they get to decide how they administer vaccinations or participate or not in trials. Additionally, if you're taking an equity approach, our tribal communities should have access to these vaccinations first, once they're proven to be viable avenues for a vaccine. And so I think that's very important. And I think that there's only one frame, it was called the Framework for Equitable Allocation of the COVID-19 Vaccine. And our Chief Research Officer, Abigail Echohawk, was the only Native participant in that group. And it was also the only group that wasn't guided by the Trump administration. And we are fortunate here in the state of Washington because the state of Washington has agreed to adopt the recommendations from that group. But I guess I would just share that that's not likely going to happen in all states. And so I'm always, approaching everything related to health systems, vaccinations, research, all of those things with a tremendous amount of caution. And at the same time, this virus has had tremendous impact on our communities. So if in fact we can get to a place where the vaccine is approved by the EPA, then I want us to get it first.
Thank you, Esther. Very powerful information there. And you've indicated such significant need. I think Russell Campbell would like to also address this topic. Russell, what are your thoughts about some of the historical context around vaccines?
So, thank you. I would say that after Karina and Esther, there's not a whole lot I can add, but I will just share. I want to back up a little bit, though. So I think when we talk about distrust, distrust is referring to not trusting someone or something, and mistrust is the feeling of not believing or having confidence in someone or something. And I think it's important when we think about that because for, Indigenous, Black, other communities of color, there is this deep-rooted distrust in both the medical and research establishments, and rightfully so, because we have been both intentionally and systemically denied treatment and known cures for diseases on behalf of research, as already been highlighted. And I would just ask, I think all of us on the panel and folks listening, to even think about your own lives and how you may have experienced going in to see a provider or a clinic, and an experience that you had where you did not feel that you were welcome there or that the provider cared for you. And my guess is that probably the majority of us have experienced that more than once. And I think that's important when we think about the importance of participating in both research and our own healthcare, because if you don't feel that you belong or that people value you, how likely are you going to walk into those settings and participate in whether it be vaccines or other treatments? And this is important, as has already been outlined, that we have to know how these things impact us, because we are not white. Our communities are diverse, and it's important to know how these interventions will interact with who we are and even potential other medications. So, we see this now, we're talking about, vaccines, and we're talking about COVID. And I even want to introduce the fact that we're talking about historical issues, but I think we have to be mindful of where we are today in the political climate and how this has been politicized. This virus and interventions and what we need to do has really been in some cases very damaging for these very same communities that have been hit so hard with this. So I think going back to thinking about why for communities of color there's this reluctance to participate, and it's not just things that happened a long time ago. I think even now, when we talk about the need to educate providers on the importance of what it means to be culturally appropriate and meaningful when we engage with, individuals from our community, we have to think about that because there's a whole history around it. Thank you.
Thank you very much for that, Russell. And for those viewers that are just tuning in now, again, you are watching a live panel discussion on vaccines, vaccinations, and you. And my name is Brent Butler. I'm your moderator today. We're going to move along to our question number 2. Actually, before I move to the question number 2, is there anyone else in the panel that would like to address or add any commentary on this before we move on to the next question? Okay, let's move on to the next question. Question number 2. What are the points of consideration when a vaccine does come out? And I just wanted to share with you that I did sign up. I did wish to offer my services to the community. I have not yet been called, but I am really curious as to what are these considerations that people in our community, the wider BIPOC community, should take note of. And our first respondent will be Esther Lucero. Thank you, Esther.
Thank you, Brent. I think I will focus more on systematic points of consideration because I think that we can hear more individualized perspectives from other panelists. I think that will be very important. So as I said a little bit earlier, from a Native perspective, I think it's going to be very important that we honor tribal sovereignty, and that means that we will have to allow Native communities and other communities of color to develop their own plans, right? Their own approaches to distributing the vaccine. I think it's very important to recognize the public health authority status for tribal epidemiology centers and not solely state systems or county systems. That's because that is where we get our public health information and our guidance. We're often kind of dismissed, even though our tribal epidemiology centers were deemed public health authorities through the Affordable Care Act and the Indian Healthcare Improvement Act, which is now embedded in the ACA. And so I think that it's also important to remember from a systematic perspective that we don't always have the capacity to administer these vaccines. And so we'll need to make sure that we have appropriate funding to support administration, staff, tracking, in all of the materials that we need to actually distribute these vaccines. And we want to make sure that there are no out-of-pocket costs for these vaccinations, because that's exactly what happens pretty standardly, that the folks who have resources are the ones who are served first. So again, like any other system, we always encourage folks to include communities in developing plans for distribution for anything. That will help get community buy-in, that allows for community champions, that also allows for cross system collaboration. So those are things I think that it would be really an advocate for. I think also we'll have to require providers to provide, to report on race and ethnicity. I think that's very key. Oftentimes we get left out of data sets, and we're going to need to know the impact of these vaccines. So I think that those are the things I would like to call attention to right now, and then again, leave more individualized perspectives to others. Thank you.
Thank you for that, Esther. Very concerning that persons with resources will receive really treatment before a lot of our elders. And I think I see Peter would like to comment on this too. Thank you so much for that, Esther.
Good afternoon. Thank you, Brent. Yeah, I want to also just build off of what Esther was mentioning around a systemic considerations when we're talking about vaccines and even just access in general to healthcare. Looking at some of the information and data that our local public health departments have, developed over the years, especially looking at LGBTQ populations, we know that from an economic standpoint, folks within the community are already kind of hitting economic and resource access issues prior to the pandemic, and then during the pandemic, experiencing disproportionate disadvantages as well when thinking about healthcare access. And so, for example, Gay City sees around 30% of our patient population that need connecting to insurance or health coverage within those that we see. And so that's one example of just thinking through how do we serve and really start to provide even the access to get the vaccine, as well as managing everything and supporting everything else in addition to that. Another area to consider is those who are most impacted by the economic downturn when it comes to jobs. Typically, LGBTQ, in particular, trans folks are seen more in retail and hospitality, which we know have gotten hit harder and are tied to job losses as well, which is tied to our employee-based health insurance as well. So things to consider, and Gay City, has found recently through some research done by UW students that having good relationships, self-determination by our community that Gay City offers to really support and hold and create wraparound services to find a healthcare provider that is invested and able to partner with our patients does equate also to better access and the more likelihood of also accessing a vaccination or a vaccine through that, as well as managing the whole patient too. So lots to consider from a systemic standpoint, and something that I think we'll need to kind of keep an eye on. I also just want to mention recently, I think this the Centers for Medicaid and Medicare have an interim rule that was released around coverage of out-of-pocket costs for Medicare and some private and Medicaid and CHIP too. So some changes to federal policy around the coverage of vaccines. However, thinking about the systemic disadvantages or disproportionate effects during this economic downturn and COVID-19, outside of that, it does look at access issues and how it's all tied to coverage, which is linked a lot to employment and those who can access those resources, which excludes quite a few folks in the LGBTQI plus community also. So really essentially need no out of cost, full coverage for a vaccine, as well as the access and ability to provide a vaccine from the communities that we're serving, and Gay Cities really believes in that. We're looking at expanding how we provide full wraparound clinical and healthcare services in the future, and look forward to partnering with our community in that work.
Well, thank you. Partnering is so important. Thank you for that, Peter. Would anyone else like to comment on this topic, of the considerations that we really need to take note of when a vaccine does come out?
I would, Brent.
Thank you, Professor Walters. Karina, please go right ahead.
No, I really appreciate both Peter and Esther's systems approach on this. It's really critical. I just wanted to acknowledge that supposedly, according to the ACA right now, with Obamacare, that right now, if the vaccine trials were to be successful and we were hitting the streets with vaccines, theoretically, they're supposed to be free for everyone. So that's currently right now. However, if Congress is successful, or the current administration is successful in dismantling or getting rid of ACA, we'll be in a much more dire situation with the concerns that both Esther and Peter has raised, with respect to who gets access, how much will it cost, and what kind of danger does that put our communities in. There has been discussion, and that's one of the reasons why these vaccine trials focus on trying to recruit people at greatest risk for COVID exposure. That is like frontline workers, essential workers including not just medical, but our janitorial staff and other essential workers in the pipeline that are disproportionately represented by BIPOC populations, right? Elders and all of these other folks would be, especially in nursing homes, would be potentially the first line of folks who would get the vaccine ideally. American Indian Alaska Native communities have been already advocating, we know, in terms of their tribal sovereignty, saying we need to be the first on the lines as well to get access to this, especially if our community participates in any trials. So I know that communities are starting to mobilize around that, and I encourage people to continue that mobilization. And certainly, I guess this is a plug to get out and vote if you haven't already. But those systemic issues are very real, and the determination of free versus cost of these vaccines could be very dangerous to a number of our communities. Thank you.
And Brent, this is Russell. I'd like to add to the voices of my co-panelists, and it's a delight to be on this panel with the three of you. I just wanted to add, in addition to thinking about which communities are prioritized, I think, when we were having a discussion last week in anticipation of this panel, the conversation around effectiveness came out. So when you think about, there's more than just one vaccine candidate. Say we have 3 vaccines that seem to be effective, and that could range in terms of how effective it is and what that means. How often do you have to get this vaccine? Most of us are familiar, if we get our annual influenza vaccine, we take that, once a year. But with these vaccines, we don't know. There's still a lot we don't know. So how effective are they? Can you take one and then take another one later? These are all questions that are unknown. And I think, the conversations should be started now with our communities around some of these different, potential options. And, so instead of waiting for there to be a vaccine or a couple of vaccines, having conversations around what does this mean? And for some of the communities, we may say, well, we want to wait to see how it's, played out with the general population before we go stand in the front of the line. And I think that's valid given everything that we've outlined here as well in terms of the historical, abuses. So I just wanted to throw that in the mix as well in terms of a consideration. Thank you.
Hi, Brent. This is Esther. If I could just add one little thing. I think I want to create a parallel here to the way that the tests were actually rolled out. So even though the actual tests were deemed free, much like the vaccinations are deemed free, I have to tell you that there were tremendous lab costs. So each test to process through a lab for COVID-19 was $100. So the burden of the cost actually fell within on the organizations that were administering those tests. I would also say additionally, the administration was very intentional about having FEMA work directly with the county systems. And so what happened was that the county systems were entirely prepared. They didn't have enough capacity to administer all of these tests. And so it was very late in the process where they actually engaged community. And so I'm extremely worried that we're going to have a very similar process for the vaccines. And that's why, to Karina's point, yes, you got to get out there and vote. And also you must be mindful about advocating for your rights. And so I just want to let folks know that there's reason for concern. We just experienced it with the testing process. I've also experienced the administration really trying to control the data outcomes. And so that also has, impacted where distribution was and was not, right? Who had access and who did not. So, yeah, I appreciate having real talk with these folks. This is very good conversation.
Thank you, Esther. You hit a really important topic, advocating for your rights. Do you have any suggestions, or anyone in the panel have suggestions of how we can advocate better or more effectively for our rights? And that's open to anyone on the panel. And I really, I know voting, I heard voting. And so that's a critical one. I've heard that. Thank you. And that's if there's any other ways that that you can think of, you can chime in, or we can try to think about that and provide that to the community at a later point. But advocating for your rights, I really think that's so important.
Yeah, this is Peter. I'll just add kind of a perspective from Gay City and the Gay City Board and also the Gay City organization wide. But as a not-for-profit that celebrated 25 years this year, as kind of a community-based org that has evolved over years, and who is represented, and we have reflected quite substantially on, you know, those that were represented over the years, and how we want to make sure that our BIPOC community is more represented as well, especially as we focus a lot of our work on advocacy. And I imagine, and we're ramping up around, you know, the COVID era as well when it comes to advocacy, which is one of our core values. But we have explicitly, you know, developed a youth advisory council made up of QT BIPOC individuals to advise our organization as well as other organizations across the local area, and have stipended them and made that a core centerpiece of our work to increase the advocacy and representation and leadership within our organization. We have also written in our bylaws for the board that a co-chair, one or more, or two of the co-chairs will always be held by a BIPOC individual. And so that is a core focus of making sure that leadership and advocacy is always kind of holding the importance of true representation and true advocacy. So I just want to stress that, you know, organizations can look at really the structures and that are in place that might be adding more barriers than are necessary to much of this work. And I think that goes across the board to healthcare services that will be also playing a huge factor within the local area too.
And Brent, if I could quickly just to add to that, to your question, I think that it's important for us as BIPOC communities, organizations, agencies, that we really not be complacent when it comes to, you know, LGBTQI+ issues. And we've seen that with this current administration. I'm specifically thinking about our trans brothers and sisters. We can't take anything for granted. We have to let both our local and national politicians and representatives know that we are watching, we expect more. And it's not because if our trans brothers and sisters' rights are taken away, you know, it's only going to be a matter of time before we're next. And so we have to think about that when we look at history. And so I think we talk about advocating, we have to be mindful, not be complacent, and make sure that people know that we're watching and we expect more and better. Thank you.
Thank you. Well said. Very important, really, to aware that we'll be next. You know, if we don't help our peers, that next person or group to be affected may be us. So thank you for that. Our next question number 3, I'm going to move ahead, is what are the risks of the unknown? If you're living with HIV/AIDS, what should you consider? And to answer that question, I'm going to first go to Peter. Peter.
Yeah, this is quite interesting, being the founding of Gay City 25 years ago was during the HIV/AIDS epidemic, and really the core of the work that we do to this day. And so, you know, during COVID, we actually still maintained much of our HIV screening services and overall services when it came to providing care. And so, you know, we provided over almost 900 HIV STI tests since March, and provided about 87 folks access to PrEP services as well. So I think that's one piece that I just want to mention is, you know, we are still, in providing services for HIV and working and to end HIV as well at Gay City. And those service, the need did not disappear during COVID, and actually had some risk of perhaps losing, access to care or, managing your HIV when a lot of the COVID shutdown did happen. And so we were so grateful that we were able to continue to manage folks' HIV with them and to provide, the appropriate screening as well. And so that's one comment that I will say is, already combating HIV with your immune system compromised, it's important to be able to access, those services so you can continue to stay healthy and be able to keep your immune system well enough to also deal with this new threat of COVID-19. And as well, we also don't really, like, another comment that I'll just kind of build off of, and I think this was more in the historical context of, as the vaccine does come out, from a kind of research perspective, we want to also keep in mind that it will be important for our communities in particular to be able to look at the data, to measure the data, to understand what is the outcomes of living with HIV and AIDS, and a vaccine impact, how that impacts our community. So it will be important that we continue to stay vigilant and provide oversight of that work from our communities as well. And I know Gay City will continue to do that and advocate as we're continuing to work with so many folks who come and seek our services in that way. And so we don't know what we don't know at this point. And so it's important to also make sure that we're monitoring and looking at it from a population health and a quality perspective as well for our communities that are the most impacted, especially those still living with HIV and AIDS.
Thank you for those words and advice, Peter. And I see Dr. Walters would like to comment on this too. Karina, what would you like to add on this topic?
Well, I just want to acknowledge two different issues. One is, if people living with AIDS and HIV have already participated in the vaccine trials and we assume that everything is successful, what they're doing right now in the stage 2 combined stage 3 of these vaccine trials is they're testing two things. One is they're double checking the safety of these vaccines for people with more immune compromised situations and other kinds of risk conditions. And two, they're looking to see if it really works. If someone is exposed to COVID, are they less likely to get it? So does it actually work? So that's the stage they're at in testing the vaccines. If we find that any one, or hopefully more than one, of these vaccines are working and efficacious and safe, then for folks living with persons living with HIV/AIDS would just continue with healthful practices that they're currently engaging in, and ideally that would mean that the vaccine is safe for people living with HIV/AIDS to take. So I just wanted to kind of highlight that. Versus right now, we don't know if you decide to participate in a vaccine trial or not, what that may impact or not your immune system function. Ideally, maybe you'll have an a good benefit. Your immune system will actually get boosted, but we cannot promise that. We don't know that. That is what the phase 2, phase 3 trials are for. So that's an unknown. I would say no matter what, if you are participating in a trial right now, it's really, as Peter already acknowledged, stay adherent to your current medication regimen, continue to keep up with your healthful practices, take the necessary COVID precautions that we already know about, and that should be your primary focus. And then if for some reason you report any negative effects, immediately notify your provider and the study team. That would be critical as well. And I just wanted to highlight one other thing that we kind of jumped over, but I just wanted to, it's related to the risks of the known, which is just as a reminder that we're already familiar with vaccines. And so vaccines can be great when they're safely tested, when they're administered properly. We've already kind of mentioned it a couple different ways, but your flu shot, we forget that's a vaccine. When if you step on a nail and you get your tetanus shot, that's a vaccine. So we're already pretty familiar with vaccines, and we practically eradicated smallpox and polio for the most part in the world due to vaccines. So we know that it can be super helpful. I think the piece that I would want folks to think about is what are the individual versus community benefits in this kind of thinking. The ideal thing is that vaccines would reduce, well, first of all, what are these vaccines, right? There's different kinds of vaccines that are being tested. That's already been acknowledged. I wanted to be clear that none of these vaccines that currently are being tested use a weakened version of the virus, and they don't use a live attenuated virus. That's actually really important. So there's no whole virus that's inactivated that's in any of these vaccines. And I know that that's been a worry, and people have expressed that. So none of that is there. Some pieces of the virus is there, some protein, they do things with some manipulation of some things, but it's kind of like, for one of the vaccine trials, it's kind of like giving you imagine a whole bicycle, right? That's the virus. But instead they may take a wheel, and they might take a handlebar, and they might take a pedal, and then they'll take those elements and take a piece of it to activate your antibodies and your immune system. But it's no live virus, it's a no whole virus or something like that. So that's an example of like one of the trials that are kind of experimenting with that. So I just wanted to put that out there in terms of the fears of the unknown around participating in that aspect of the vaccine trial. The individual benefits, though, is, the ideal benefit is that so people don't get sick and that they can recover faster if we're successful. So that means fewer hospitalizations and deaths. Our communities are getting hit hard, and ideally to prevent new infections. And at the community level is to reduce the rate of transmission of this disease, to slow it down or stop it, basically create healthier communities. And actually, you hear Trump administration talk about herd immunity. They're not using it properly when you hear the president talk about this. Vaccines, ideally, if it's 70% effective, which was what we're hoping for, then we can hope for proper herd immunity that would be very slow in a way of getting people being able to cause less stress on communities and health systems and prevent outbreaks and things like that. It's not the way that they're talking about it, which is like get everybody exposed. That causes millions of people to die. That's not a proper version of herd immunity. So I just wanted to put that out there in terms of the unknowns. And then finally, in terms of the current research and all the studies that are going on out there, you should be informed if you decide to participate in any of these trials. You need to be very clear of what the risks and benefits are, not only to yourself, but to your community. They should be able to answer those questions. Right now, the potential risks are primarily swelling, pain at the site, rash, headaches, nausea. They're not common, but they're possible. So you should know that comes with any of those trials right now. But we don't know about any other longer term risks or anything like that. It's very new. And some of these ways of doing this is new. And so hopefully we will have some success and our communities can make some informed choices. Again, it's about sovereignty, individual sovereignty and tribal sovereignty from a Native perspective for people to be able to make clear, informed decisions about what's in everyone's best interest. So thank you.
Thank you for that really, what I consider a comprehensive overview, because some of that information about herd immunity isn't out there. I really appreciate that, Dr. Karina. And we have an opportunity for the panel to answer any questions, but I just wanted to let the panelists know that we do have a lot of questions that have come in. So if anyone would like to chime in on this question, please go right ahead.
I can answer Mitchell's question about Mitchell has a question about any information about those who take HIV/AIDS medications. particularly the retrovirals, if it's led to some of those with COVID being ahead of others and quicker recovery from COVID. That we don't know. I'm sure they're looking at that right now in some of the vaccine trials because they opened it up to allowing people who are living with HIV and currently on medication to participate in those trials. I'm sure that will be one of the questions that will be answered, but right now we don't know.
So I'll just, JD's question. So Karina just touched on this, but she talked about informed consent. So for we highlighted all the abuses that have occurred and in the name of research, and because of that, there have been all these protections we call human subject protections that have been put in place to make certain that people are not abused and that people are really cared for, that things are safe. And so there are so many different people, groups looking at this, constantly watching to make sure that people aren't abused. And we can, provide you with more information about that later. But I do want to let folks know that because of these historical abuses, there's systems and policies that have been set up to prevent that. Thank you.
Thank you, Russell. And we're going to move on to the fourth question. And we can advance the slide set. And our fourth question is, what are some of the modes to help prevent transmission? And I think this is really important. We're seeing a second coronavirus wave occurring in different parts of the country and significantly overseas. So I'm going to move to this question to Peter.
Thank you again. Yeah, such an important question too, and I think there are a few items that I just wanted to highlight here. So, face masks have been really political piece in today's world, but have been proven to be a very effective piece, and that's not just surgical or specific face masks, but also cloth face masks for those who are not able to access medical masks as well. And that also kind of going back to what Katrina was saying, or Karina was saying about community versus individual perspective is, you wear a mask, and others wear masks to protect the others around you. So that's the piece that's really important. I think that's been helpful to hear is, wearing masks for your community, for those you are around, to protect them just as much as they wear their masks to protect you. As far as typical washing of hands, making sure that you're using appropriate hand hygiene when putting on your mask, when coming back from being outside of your home or your house. And lastly, social distancing, I think, is really key here, and it's been really difficult. A lot of the kind of environment has changed for many people during the last, months of the shutdown. And so with social distancing, I'll just highlight a few things. Gay City's website has a robust amount of resources linked on our website. That was, another amazing feat of our amazing staff to be able to post an online resource focused on our LGBTQI plus communities. One of which I'll highlight is the ability to think about sex positivity during quarantine. And I think that was an interesting kind of data piece of, we are still, sexual beings, and one of Gay City's values is sex positivity as well. And so that's something to, access that the whole realm of resources during quarantine on our website. So I encourage folks to check our COVID-19 resources page out on gaycity.org. I also, will mention two other things. So our Youth Advisory Council, which I mentioned before, an amazing group of individuals started to host queer and teen Instagram live feeds that were run by the youth for the youth to build kind of a community to really reduce kind of feeling of isolation during this period of time, which we've read research about, people feeling isolated during virtual events or being quarantined as well. And so that's something Gay City has done for youth and really kind of in our core mission around self-determination and creating space and community for especially our youth community that are most impacted. And lastly, we hosted some virtual events related to COVID-19, specifically around our LGBTQI+ community. So when social distancing, we also have to think about how do we show up for our community and what the organizations do to make sure that we maintain our communities during this time. And so that's just something really important that I know Gay City has spent a lot of time thinking about. And so wanted to highlight those.
Thank you very much for that, Peter. And really, we really thank Gay City for what they're doing for our community. It is significant. And I see that Russell would like to also weigh in on this question. Russell, what are some of the other modes to help prevent transmission?
I think it was all covered. I mean, really, I don't have anything else to add. Thank you.
Okay. Would anyone else like to comment on this? Would any of the other panelists have anything to add? Okay, then I'm going to move on to our fifth question, and so we can advance our slides. And our fifth, and this is actually our last question of the day. What are the points of consideration when a vaccine does come out? And Russell, I'm going to go back to you. What do you see as some of these points of consideration? Okay.
I touched on this a little bit before, and I think Esther did as well. But I would say even, instead of waiting for a vaccine or vaccines to come out, we should start having conversations with our communities. We should be doing virtual town halls and having these discussions around what does this mean for you? Because, we're looking at this just this directional way of saying what's going to you, and instead of saying from the community, like, what does this mean for you? What would you like to see? How does this benefit you? And I think that's one of the things we often miss, because just because I have an intervention doesn't necessarily mean people are going to want it. I mean, we can look at so many different things, whether it be PrEP, birth control. We can talk about so many different things, but we have to think about what does this mean for the community? What would they like to see? And to get that buy-in, and I think we have to start there. When we talk about community engagement that's culturally appropriate, we have to start there and having those conversations. And we have to be able to have, the conversations they have to be transparent, they have to be open, they have to be honest. And we start from there. And then when there are vaccine candidates, we can, we're not starting from scratch and we're not scrambling trying to put something together. So we have that now as part of the conversations about everything else in terms of what's best for a particular community. Thank you.
Very much for that, Russell. And Peter, would you like to add a little bit of information on this topic as well? What considerations when a vaccine does come out?
Yeah, I think I also touched on this in the previously, but I'll just also, I think we talked a little bit about kind of the dissemination as well. And so know that, all of the different healthcare providers are engaged in these conversations now. So, how to operationalize that for everyone. So I encourage folks when they're engaging, with your providers to ask them, what does this look like, and how do you learn about it, and from their perspective, what does that look like? So there are kind of guidelines from the federal level, but how do we look at this from a local level as well, with our healthcare providers and those we're seeking care from currently as well.
Thank you very much for that additional comment, Terry, on this topic, Peter. And I just wanted to shift over to the whole panel. This is our last question, and I just wanted to see if there were any other panelists that would like to add any comments on this. And I know we've covered some of this significantly, covered most of the areas. If there's anything else that you would like to add, please go right ahead.
Yes, hi, Brent. I'd like to add something. I wanted to add that because they're combining a phase 2 and phase 3 trials for these vaccines, and because they're going to get these to market as quickly as possible, we don't really know, and we will not know by the time we probably get the vaccines, really what the long-term effectiveness of these vaccines are, which means we will still need to be wearing our face masks even with these vaccines. And it's important to keep that in mind because I know we are getting already COVID fatigue, and people are kind of like, oh my gosh, when we get the vaccine, I am just throwing my mask out. But I just want to caution us that probably won't be true. At least hold on to those masks for a little while. It'll be our new normal, at least for another year or so. So kind of keep that in the back of your mind. And why are masks so important? We already know there's already evidence out there that it can reduce the coronavirus spread by 40 to 50%. That is really effective and already really great. So no matter what happens, I would say just be ready. We're going to, rock your masks, get the coolest looking mask you can imagine for the next 12 months to 18 months. But we will have masks for a while, and just be prepared for that. And then also, I wanted to add to something that Russell had mentioned is at the community level, I think it's really important that we continue to have these ongoing conversations about why wear masks and why do we do some of these more physically distant activities and get outside, improve. If this isn't a great wake-up call for us to get healthier, so that if we do get exposed to this, regardless of the vaccine, if we do get exposed to it, we can actually take control of our health right now and begin to improve our lung capacity. Throw those cigarettes out if you're smoking, eat better. I know it's hard, COVID carping, we're all doing it a little bit, but this is an opportunity for us to take control of our own physical health so that if we do get exposed to it, we have better outcomes in our communities. So I would say this is an opportunity for us to, this is where we do have control. We have an opportunity to exercise, eat better, and do some of those things that improve our lung capacity so that if we do get exposed, we have better chance of survival regardless of vaccine. So I would encourage us to do that. And then also remember why we wear our masks. Our masks aren't just to protect ourselves, it's to protect our community. And most importantly, from our Native community perspective, but I think this is true for other BIPOC communities, we're protecting our elders. We're protecting our community libraries, literally. They're the knowledge keepers. They hold so much important information that we want them to be with us as long as possible. And so continuing our culturally based mask campaigns is, I think, really critical. So thank you.
Hi, Brent. This is Esther. I'm wondering if I could tackle Mitchell's question just quickly.
Yes.
In the chat. Okay.
And I'll read it real quickly. Do you want to read it for the audience, for those that are on the call?
Sure. So Mitchell says, when we think about access for physically distanced events, how can we better support our LGBTQ+2S folks, including our elders? Culturally appropriate conversations are still primarily happening online or virtually. And I understand where you're coming from with this, Mitchell. Like, not all of our elders have easy access to, tools to be able to utilize virtual visits. And so I'm just going to give you some perspectives at the Seattle Indian Health Board. So we have an elders drop-in center. Many of our elders actually identify as Two-Spirit as well. And the challenge that we have within our elders program is that about 40% of our elders are actually homeless, right? And so when we're asking them to shelter in place or stay at home, we're asking them to sometimes stay under a bridge, right? And especially with the libraries closed and those types of things, although I recognize they just reopened, we had to take a different, more of a harm reduction approach. meaning that we actually had temperature checks at the door. We gave people access to actually hand washing, washing their clothes, being able to stay safe. We handed out masks to everybody as they entered, and when they exited, they would dispose of that mask and take a new mask. We switched from communal meals to boxed lunches and boxed meals that they could either take with them or they could eat in a socially distanced way. And we created a space where there was a socially distanced environment. So that was more of a harm reduction approach to things, where our elders could still interact with one another, get access to quality health care, and then, not suffer from that social isolation. Additionally, we have Two-Spirit elder in our community who requested to have a gathering because it had been so long since they'd gathered, and so many of our folks there are also Two-Spirit. And so at the Seattle Indian Health Board, we had a large enough space where we could create a socially distanced environment for up to 10 people. And so similarly, we did individual meals and those types of things so that we could actually reduce the risk. And same thing, temperature checks when they came in, gave everybody masks, and just making sure that we abided by those recommendations. So I just want to share that. And I recognize that's more of a harm reduction approach, because ideally we'd all be able to access, virtual environments and stay feeling connected. And when that's not the case, then we still have some guidelines that we can abide by and meet those needs.
Esther, thank you. There's no more vulnerable adult than our elders that are homeless. So thank you for bringing that to our attention. And before we move on to our close, I just wanted to circle back to what Karina said. Have fun with your masks. I have a mask here. This is with chickens and roosters on it. So we want to make sure we're having fun, even in the pandemic. So as we move on to the close, I wanted to acknowledge that we've been very fortunate to have someone nominated by a Pulitzer Prize winning author, Jericho, the author of Tradition, to read one of his poems today. And he's a young and upcoming poet locally. And so just to give you acknowledgement to Professor Brown, who Tradition was published by Copper Canyon Press, based in Port Townsend, Washington, for which he won the Pulitzer Prize. He's also the recipient from the Guggenheim Foundation of Fellowship, the Radcliffe Institute of Advanced Study at Harvard, and the National Endowment for the Arts, and he is currently the winner of the Whiting Award. Brown's first book, Please, won the American Book Award. His second book, The New Testament, also published by Copper Canyon in 2014, won the Ainsfield Wolf Book Award. His third collection, The Tradition, won the Patterson Poetry Prize and was a finalist for the National Book Award and the National Book Critics Circle. Jericho Brown is currently a professor at Emory University and, as I stated earlier, nominated poet Luther Hughes to read one of his poems at today's event. And I just wanted to share a little bit about Luther. Luther Hughes was born and raised in Seattle. He is the author of A Shiver in the Leaves in 2000 and a chap book, Touched, Sibling Rivalry Press in 2018. He's also the founder of Shade Literary Arts, a literary organization for queer writers of color. He is the executive editor for The Offing and co-hosts the Poet Salon podcast with Gabrielle Bates and Dujay Tahat. His work has been published in Poetry, Paris Review, The Rumpus, New England Review, and others. He is the recipient of the 2020 Ruth Lilly and Dorothy Sargent Rosenberg Fellowship and the 2020 92Y Discovery Poetry Prize. Luther received his MFA from Washington University in St. Louis. Welcome, Luther. We're looking forward to your reading today to close our panel session.
Thank you so much, Brent. As Brent said, I'll be reading a poem from Jericho Brown's award-winning book, The Tradition, which is a phenomenal and luminous book. Foreday in the Morning by Jericho Brown. My mother grew morning glories that spilled onto the walkway toward her porch, because she was a woman with the land who showed as much by giving it color. She told me I could have whatever I worked for. That means she was an American, but she said it because she believed in God. I am ashamed of America and confounded by God. I thank God for my citizenship in spite of the timer set on my life to write these words. I love my mother. I love Black women who plant flowers as sheepish as their sons. By the time the blooms unfurl themselves for a few hours of light, the women who tend them are already at work. Blue. I'll never know who started the lie that we are lazy, but I love to wake that bastard up at Foreday in the morning, toss him in a truck, and drive him under God past every bus stop in America to see all those Black folk waiting to go work for whatever they want. A house, a boy to keep the lawn cut, some color in the yard. My God, we leave things green. Thank you.